Good afternoon. My name is Danika. My partner is Emily, and we decided to do rib fractures for our injury. So just an overview on the ribs. The ribs are classified as flat bones, and flat bones serve as a point of attachment for muscles. They are thin and curved, as you can see on the right. Ribs form the thoracic cage in the chest, and then there are typical and atypical ribs. Typical ribs are wedge-shaped heads, a neck with no bony prominences, and then the shaft is flat and curved. Atypical ribs have features that aren't common in every rib, and those include 1, 2, 10, 11, and 12. So anteriorly, true ribs are 1 through 7, so they attach to the sternum. False ribs are 8 through 10, and they attach to the cartilage of the superior rib. And then floating ribs are 11 and 12, so they don't attach to the sternum at all. Posteriorly, all of the ribs are connected to the thoracic vertebrae in the back. And the functions include supporting the upper body, protecting the organs, so the heart and lungs, and then aiding in respiration. What is a rib fracture? So a rib fracture is really common. It's a break or a crack in one or more of the ribs. The more ribs you break, the more severe the complications could be. So ribs 4 through 10 are the most common ribs to break. 1 through 3 are associated with high energy trauma, and then 11 and 12 are the floating ribs, so they're more mobile and harder to break. A mechanism of injury is a method in which that injury occurs. So for ribs, the most common mechanism is a blunt or penetrating trauma. That can include a car accident, a fall, a collision, or even an attack. Other mechanisms include athletics, so sports such as rowing, gymnastics, and golf. You have that constant rotational movement and that pounding of the body, so that's leading to microtrauma. That can build up over time and creating a fracture. CPR can also break ribs, as well as, in slight cases, severe coughing, and then other underlying diseases. So just some key numbers. As I said before, rib fractures are very, very common. They account for about 12% of all the fractures seen in patients, and then 10% of blunt trauma patients have broken ribs as well. Children have more elastic tissue in their ribs, for growing and development, so they're less likely to sustain a rib injury. On the other end, elderly have more frail and weak bones, so they have a much higher morbidity and mortality rate. Like I said before, some risk factors: age, contact sport participation, and then underlying diseases like osteoporosis. On the right, osteoporosis is when the new bone creation doesn't keep up with that old bone removal. And a comorbidity is when 2 or more medical conditions are present at the same time in one patient. So with rib fractures, a brachial plexus or subclavian vessel injury can occur, a pneumothorax, which is air between the lungs and the chest wall, a hemothorax, which is blood in the pleural cavity, pulmonary laceration, lung herniation, and then liver, kidney, and spleen traumatic injuries.
The main symptom of a rib fracture is pain. The patient will feel pain when taking a deep breath, pressing on the injured area, or when bending or twisting the body. They will also experience pain when lying on the affected side and achiness at night or first thing in the morning. The most common way to rule out other injuries or detect associated injuries is with diagnostic imaging. The most common imaging used for rib fractures are X-rays, CT scans, or MRIs. During an evaluation, the doctor will begin by obtaining the patient's history, which can be very important as it can uncover complications or underlying injuries. Then, the doctor will test the patient's range of motion, observe their breathing, palpate for bony tenderness, and search for chest wall bruising. Most broken ribs are able to heal on their own within 6 weeks. Pain medications such as opioids like oxycodone or hydrocodone or over-the-counter medications like anti-inflammatories can be used to help relieve pain. The patient must restrict all activities and ice the area regularly. Surgery is not usually required but may be necessary if the fractured ribs impair breathing or puncture organs. The most important rehab for a rib fracture is rest. After the pain begins to go down, the patient is free to walk, do housekeeping, or run errands. Deep breathing exercises and coughing should be performed once per hour. After pain begins to diminish, the patient should focus on strengthening supporting muscles of the arms and torso to relieve rib strain. If necessary, physical therapy can be provided for older or weaker patients to help with normal daily activities. While rib fractures cannot always be prevented, some ways that can help include wearing proper protection during athletics, strengthening your bones with plenty of calcium and vitamin D, and reducing your risk of falls.